My topic is supervised consumption facilities and overdose prevention sites. With a growing amount of overdoses and deaths, I want to focus my presentation on why we should support these. So a supervised consumption facility is also known as an SCS. It's a legal sanctioned facility that allows people to consume pre-obtained drugs under the supervision of trained staff. SCSs are designed to reduce the health and public order issues that are often associated with public drug use. The staff does not directly assist in the consumption or handling of the drugs. The drugs are brought in by the clients. The staff is provided to answer questions on safe injection practices. They can administer first aid and monitor for overdoses. For example, the drug fentanyl. The overdoses are rapid, and waiting for an ambulance can result in death or permanent brain damage. So if you're at the consumption facility, we have the staff that's there to immediately assist and help. They're also there to offer general medical advice as well, referral to drug treatments, medical treatments, and other support systems. Some of the supervised consumption facilities actually have medical treatment and support systems available along with counseling at their facilities. Along with supervised consumption sites, we also have overdose prevention sites. Like the supervised consumption sites, overdose prevention sites, also known as OPS, are sites used to supervise the use of drugs and prevent overdoses. OPS are the first step for communities to start the process of getting the permanent supervised consumption facilities. They are put together to immediately address a community's needs, while the supervised consumption sites are already permanent facilities in the states or countries that they're in. So why are these facilities a good idea? One reason that these facilities are a good option for drug users is because overdosing on a drug like fentanyl can become deadly quickly, as I had mentioned before. At these facilities, the staff is able to act quickly and hopefully prevent future overdoses. They provide you with a secure environment, along with withdrawal management, primary care, and referral to specialized services. Between 1999 and 2018, nearly 450,000 people have died from opioid overdoses. This is including prescription opioids, heroin, and synthetic opioids. These facilities are controversial and can be seen as encouraging drug use, but in reality, they're playing a vital role in our approach to drug use and policies. So there are currently 120 supervised consumption facilities open in 10 different countries, including Australia, Canada, Denmark, France, Germany, Luxembourg, the Netherlands, Norway, Spain, and Switzerland. As of right now, the U.S. does not have any of these facilities open. But state legislators in California are working on a bill to start a 3-year pilot program. Denver and Philadelphia are also interested in opening centers as well. The Public Safety and Human Services Committee of the Seattle City Council is working on establishing a city-funded injection site as of 2020. There's a lot of controversy with these supervised facility sites. They face criticism and have challenges to face when it comes to the criminal justice system and treating drug use criminally. People are going to do drugs regardless of the laws, so being able to do it safely is a huge step in helping our health system. They are both the gray and the robust points to the benefits of these facilities and the prevention of deaths, according to Gordon. A 2014 review on 75 studies concluded that these facilities promote safer injection conditions, reduce overdoses, and increased health care. They currently have no negative impact on crime or drug use, and there has been no reported deaths at any of the injection sites as of 2018. The final Heroin Opiate Addiction Task Force report is a comprehensive strategy that focuses on prevention, increasing access to treatment on demand, and reducing the number of fatal overdoses. The Heroin Addiction Report is blaming Seattle's homelessness issues on drug use. They say that opioid use is a significant cause of homelessness in Seattle and a reason why many in the homeless population remain so. Research shows, in particular, that homeless opioid users in Seattle have greater difficulty obtaining access to treatment, and the cost of maintaining a drug habit prevents users from assembling the resources needed to secure stable housing. Seattle is pushing back due to those recent statements from Canada's injection sites saying that these facilities are increasing death rates, opioid-related calls, decreased safety, increased crime, and an increase in needle debris. Although this may be the case in Canada, it should not stop the creation of these facilities in Seattle, where opioid use is clearly taking over. Most of these injection sites are linked to positive changes in drug use, and studies have linked safe injection sites to a decrease in drug use and a higher rate of seeking rehabilitation and recovery services. So what are some of the positives? These sites result in the reduction of HIV and hepatitis C. There's a reduction in disease-spreading behavior, such as the sharing of needles. We are reducing disease and death, reducing public injection and public danger. There are fewer drug overdose deaths and hospitalizations. We have an improved understanding among users of addiction, and it is reducing medical costs. Along with the positives come the negatives. Some of the negatives include encouraging drug use. We now have easily accessible needles in facilities. Individuals may feel drug use is now accepted due to these facilities. There can be an increased crime rate. Some studies have shown that this is encouraging drug dealers to sell near the facilities. We have the issue of money. People don't want to fund someone else's drug issue, and we need the money for these facilities to be running. With these facilities, people also argue that they are encouraging drug use because without the fear of disease, needle shortage, or hardship, it can lead to an increased use of drugs. Now, what are the facts involved with this? A literature review of over 100 studies of safe injection sites show that there have been 88 fewer overdoses per 100,000 users, a 67% reduction in ambulance calls for overdoses, a reduction in the average length of drug-related hospital stays from 14 days to 9 days, and a reduction in syringe sharing from 37% to 2%. So what does the future look like for us in the United States? As of 2019, there were around a dozen cities across the U.S. that have been considering opening up supervised consumption facilities, but the Department of Justice in Washington has intervened, saying this is in-your-face illegal activity using some of the most deadly, dangerous drugs that are on the streets. We have a responsibility to step in. There are also barriers that we have to come in the U.S., including policy. Federal and state policies have implied that those operating the facilities or those accessing services may be at risk. There's misinformation, encouraging drug use, bringing more drug users to communities. There are many questions that need to be resolved. And then we have sustainability. Is the funding and support needed? Do we have it in the U.S.? Are we going to be able to get that? Are there going to be people that are willing to fund drug users? So in conclusion, these sites give addicts the opportunity to safely do drugs, join programs, and get education on drug use. There's a bigger picture than just a spot for addicts to shoot up opiates. We are helping family members and friends of addicts. As for family members and friends of the addicts, there's also a great first step in pushing the addict to receive help or at least act a little more safely if they decide they want to continue using drugs. The best way to implement drug use in supervised injection sites is to give them a chance. Our drug problem is not just going to go away. People will continue to use opioids and spread diseases and deaths. We have to look at the fact that we are not supporting drug use. We are encouraging safe acts, medical care, and support when one is ready for it. We need to bring awareness. I believe bringing awareness to supervised injection and overdose prevention sites is a great first step in educating individuals that just see drug use as an illegal activity. Just giving it a few chances in states that have big opioid problems could be a great way to determine if these are going to do more harm than good or vice versa.